Hello everyone, and welcome to our fourth episode of Bridging the Evidence Gap. My name is Alice Obrecht and I'm a research fellow here at ALNAP. For those of you who listened to our previous webinar episode, you will notice a common theme between these two episodes. Over two episodes of this webinar, we're looking at the challenges faced by humanitarian organizations in insecure settings. These are contexts which feature active violence or conflict, and where this violence, along with other factors, can lead to barriers for humanitarian organizations seeking access to people affected by crisis. Now, the previous webinar, which was chaired by my colleague Alexander Warner, was looking at this issue of monitoring in insecure settings. So how can humanitarian organizations monitor needs and monitor their projects in settings where having a physical humanitarian presence is quite difficult? If you missed that episode, please go and check it out on our website. The transcript and the audio with the presentation files are online. But today we're going to be looking at a different question, one that is slightly more basic, but it's also one that hasn't really been answered very well to date, which is who is actually operating in these settings? Which actors are in the hardest to reach humanitarian settings, and what are they doing to meet needs? This is the question of humanitarian presence, and it's a really important one for helping us understand the coverage of humanitarian assistance. That is, how successful is humanitarian assistance at meeting the needs of the worst off? Well, today we have two fantastic speakers to help us puzzle through these issues. The first is Abby Stoddard, who is a policy analyst and partner of the consultancy team Humanitarian Outcomes. And she'll be talking about the unique mixed methods approach that Humanitarian Outcomes recently used to get a more accurate understanding of the realities of humanitarian presence on the ground and an understanding of what factors are shaping presence. We're then going to hear from the practitioner perspective, and for that we have Sandeep, the Information Management Officer for OCHA Afghanistan, who is joining us from Kabul. Sandeep will be talking about the multiple tools that OCHA is using beyond the 3W sheets to answer the who's out there question on the ground in Afghanistan. So that's who we are today. We'd now like to learn a little bit about who you are. So you'll be seeing a poll appear on your screen, and please fill that in while I cover some brief housekeeping points. We've limited ourselves to two speakers today, as we'd really like to leave a lot of room for questions and discussion, and because the two speakers that we have such rich experience and expertise on this issue. So many thanks to those of you who have to all of you participants who have submitted questions beforehand. We've already woven those into the discussion questions towards the end of the webinar today, but please do keep submitting your questions throughout the conversation. To submit those questions, there is a question box in your webinar menu on the right-hand side of your screen, and we will be doing our best to incorporate as many questions as possible. Many people continue to ask us about whether or not this webinar will be recorded, and the answer to that is yes. You will have access to an audio as well as video of the presentations and their slides in about 2 to 3 weeks' time, as well as a transcript. You'll also see today, as we go throughout the presentations and the Q&A, links to relevant websites and pieces of research that both Abby and Sandeep will be talking about, and those will be appearing in your chat box. So keep an eye out for that. I think we will close the poll now. Good. So we have a lot of people with general interest in this in a professional capacity, and some who are using data on humanitarian presence, and very few who are collecting data, and that might be because of the difficulties in collecting this data. So it's a good thing we'll be talking about how to improve our approaches and our methods in doing this. And so to get us started on this, we're going to turn over to Abby Stoddard. I've already given a brief introduction to Abby. Abby is a very well-known, I think, humanitarian researcher with extensive expertise in humanitarian research, including as the lead author of ALNAP's most recent edition of the State of Humanitarian System report from 2015. But today Abby's going to be talking with us about research that she's carried out as part of the SAVE research program. This is the 3-year research program on secure access in volatile environments funded by UK DFID, and is the first major effort to answer some of the aid world's most critical questions about how much aid is getting to war zones and how much that aid is helping. There are three components to this program. Elias Sagmeister from GPPI was on our previous webinar talking about the monitoring component, and today Abby is here to discuss the unique methods that they've been using to get a better empirical understanding of humanitarian presence and the factors that shape this in insecure settings. So we're looking forward to hearing from Abby, who's going to be giving us a presentation that covers both the, the findings that they've obtained from this research, as well as some of the method. So over to you, Abby.
Thank you. Sorry for that delay. And thanks also to ALNAP for letting me be a part of this today and to share our research this way. So I think you introduced the SAVE program pretty well, so I don't think I need to go through the background and structure of it, except maybe just to add that as a multi-year and multi-country study with a major field-based component, it was definitely the largest and most ambitious, and I think the most data-intensive study that we've done to date at Humanitarian Outcomes. And we were really pleased to partner with GPPI in taking it on. The goal of the study was to contribute to solutions for improving aid work in highly insecure settings. And as the initial phase of the research area that I was leading, what we were trying to do was, in a sense, to lay the empirical evidence base to measure and to show concretely how insecurity and violence in the operational environment affects humanitarian presence and coverage needs. So I'll be talking about the first component, presence and coverage, today. And these were the four countries that we were looking at, Afghanistan, Syria, South Sudan, and southern Somalia, which for the time period of the study, but also still largely today, had the highest levels of insecurity in the form of major attacks going on and aid worker casualties, and access constraints, which is why they were selected for the study. Now, some of you may be familiar with Humanitarian Outcomes work in quantifying insecurity for aid workers and the aid worker security database that we run and have run for the past several years. So measuring the insecurity in these places was, in fact, the easy part for us. The more difficult questions we were seeking to answer were, in these highly insecure environments, what is the level of humanitarian field presence in relation to people in need, which is a way of saying what is the humanitarian coverage? And then how is this humanitarian coverage level affected by changing security conditions, and can we measure that? And finally, are the types and sectors of programming affected by insecurity in these environments? And the biggest challenge, which is one I think that many humanitarian researchers are familiar with, is that the data that you need to answer these questions are just not readily available in any compiled form. And we know MSF famously asked the question, where is everyone? And when that report came out, I remember being struck by the fact that the answer is we really have no way of knowing at present, because detailed information on the humanitarian footprint country by country simply doesn't exist. So essentially it's necessary to go out and gather these numbers and compile brand new data sets in order to answer these questions. And that's essentially what we did in the SAVE study. So we were looking to fill kind of major evidence gaps by gathering numbers first on humanitarian presence, which we defined as the number of organizations, personnel, and project activities per location in these countries. And by setting that against the number of people in need of humanitarian assistance in each area, we were able to calculate a proxy for humanitarian coverage. Now, I say proxy because ideally, humanitarian coverage would be measured by the percentage of people in need who are reached by and have had their needs met by humanitarian assistance. Now, to do that would be a whole other level of difficulty for the research, because one of the inconsistent ways that people in need are estimated across emergencies, and how the aid recipients in each place are divided up and cross-cut by sectors and overlapping agencies, and then the inevitable double counting that occurs. But so for our purposes, this was a useful proxy just to try to measure how insecurity affects the level and the configuration of aid operations. Right, so in terms of how we went about this, field work was really predominant in the data gathering. We had field-based researchers working with local research partners, doing the actual data gathering and verification in the field. So they would begin by compiling the existing data sets that existed, and here is where OCHA came in very, very helpful to us, and were providing us with the 3 Ws that existed in these places, and as well as other data sets and registries. So that was a really useful jumping off point. From then, they did systematic consultations of all the humanitarian actors in the context, both international and national, and essentially counted up the presence data. And they were assisted in this by confidentiality protocols that we developed in order to assure agencies that all this information would not be published against their specific agency's name, but would be anonymized and aggregated in any sort of public sharing of it. We also, of course, did some qualitative information gathering, and that was the practitioner interviews. So we interviewed all of these actors more in depth, and really focused on the decision-making that they did regarding operational presence. So what were the determinants of their setting up operations? What were the conditions for expanding or contracting their presence, and things like that. Really looking at where and how they operate. And then we did affected population surveys that were targeted to people living in these very hard to access locations. So mostly these were done via remote telecoms using interactive voice response technology. That's how we did it in Afghanistan, Somalia, and South Sudan. But in the case of Syria, it was deemed safer for the respondents, and would encourage them to respond more if we actually did in-person surveys rather than do something over the phone. So we partnered with a local research institute called Proximity, who was able to go into 4 governorates and actually do household surveys for us. And what these surveys were asking people was the aid presence that they were seeing, the organizations that they saw in their areas, whether the presence was declining or increasing, and also the type and the quality of aid that they were receiving, and whether it met their most urgent needs. So that was a way of sort of triangulating the other quantitative and qualitative data that we were gathering for the study. So as you can imagine, we faced some pretty significant challenges, many of which were expected, including the fact that aid organizations didn't always have complete and comprehensive records of their operational data, and often not at the level of granularity that we were asking for. And with some organizations, even if they were able to get us fantastic, totally comprehensive numbers for the current year, as we went back in time, the data would get spottier and softer. So we were asking for the current year and as many years back as they were able to provide. And for some organizations in some places, and this was especially true in Syria, we found a real deep reluctance to share the operational information, even with the confidentiality and anonymity assurances. Now, this was due to what we think are genuine security concerns, and what in Syria at the time was an atmosphere of sort of intense distrust. But we think as well there were some reputational concerns at play when the presence of agencies was not quite as extensive as they would have liked, and they weren't keen on that being shared necessarily. And finally, we faced the basic limitations of doing a part of our quantitative analysis, which was the statistical regression analysis on observational data. So listeners probably know that it's notoriously difficult for social science research taking place in complex real-world situations to meet the threshold for statistical significance and to make very strong claims in terms of attribution and causality. And so maybe it was naive of us to try, but I mean, I can tell you what we set out to show and what we were hoping we would find. We wanted to see for any particular area whether there was a strong inverse correlation, a statistically significant one, between rising insecurity and declining aid presence. And while the data that we collected did show overall patterns that suggested this pretty strongly, it did not meet the threshold for significance. And in the report, we go into the variety of confounding factors that explain why we think this is. However, even though those regressions were inconclusive, that as I said, was only one aspect of our quantitative research, and the other parts of it did yield valid and, we think, interesting and useful findings. And those are the findings that I'm going to go through with you now, just briefly, hitting kind of the highlights. The first is the broad finding that only a surprisingly small number of organizations consistently work within the most dangerous locations in the most dangerous countries. And it's clearly not enough to meet the total needs in any given area. Now here you can see that out of all the emergency contexts that took place during the study period, those at the top of the list with the highest number of major attacks, shown in red on the right, have a relatively smaller number of organizations responding to the emergency per $100 million in funding, represented by the blue bars. And if you look on the bottom, the natural disaster type emergencies in more stable and secure countries on the bottom that have fewer, zero attacks, have generally larger numbers of organizations responding. So maybe not too surprising that the more secure countries attract the larger numbers of agencies responding. But we were able to use the presence data that we gathered from agencies to dive deeper into who was present and who wasn't. And we were able to calculate a ranked index of the most present organizations. So the ones that in these countries, in the highly insecure countries, were operating in the most dangerous areas as measured by acts of violence that took place there. Now, we were working with an applied mathematician to do this, my co-author, Shoaib Jilani, so shout out to him, and also a few statisticians. So what you're seeing now is in its kind of anonymized form, but you can see that it's only about 7 INGOs, a Red Cross movement entity, 3 UN agencies, and several national NGOs, which in every context we found would be at the forefront of operations in the most insecure places, and who, of course, are critical to the overall response. A second, a more qualitative finding, but one which was supported by the data and the affected population surveys, was that security, or the lack of it, represents for agencies the most important determinant of where they are present. So more than the level of need, more than the availability of funding, their decisions are mainly determined, driven by the state of security for their staff. So what happens is that this results in unequal or skewed coverage, where you see larger numbers of agencies clustering in more safe areas, leaving coverage gaps in other areas where the needs may be far higher. And that donor policies, including counter-terror legislation and financial regulations, will contribute to this and exacerbate the skewing effect by making agencies even more reluctant to work in these high-risk areas. And just to quickly use Afghanistan as one example, you can see here that the insecurity is represented by the darker shades of red, and the level of humanitarian coverage that we calculated shown by the blue circles. So I think you can see on its face that coverage is generally higher in the less insecure northern provinces, and lowest of all in the Taliban strongholds of Helmand and Kandahar, which have seen more violence and displacement, and where very few agencies are working even still. And the reason why subnational data that we collected is so important here is because the skewed and declining coverage is something that you really can't see at an overall country level. So it's rare nowadays that an organization will pull out of the country completely, even if it's been attacked. So you get roughly the same number of organizations in the country year after year. But what you don't see is that they may have contracted their presence, pulling back often to provincial capitals or the national capital, and shrinking their presence and activities in the field, the number of staff in the field. So what you see here is the declining average number of districts that agencies cover in Afghanistan over the period of the study. So this has been a trend that has really been obscured by lack of detailed data. The data that we collected and the survey findings also showed pretty clearly that in the insecure, hard-to-access locations, programming in general becomes more basic and rudimentary, and really less able to be targeted to specific vulnerable groups. And this stands to reason. Organizations that cannot move their staff freely within a country will have trouble getting the skill sets they need out in the field, and that limits the technical complexity of what they can do. And especially when their staff and programming is highly localized, meaning everything is done using staff hired from the immediate vicinity, or when they're working remotely through local partners, it becomes still more difficult to identify and target the most vulnerable, and may not be culturally accepted to do that. So instead, the focus will shift to reaching more people with simpler sort of deliveries. And then we also found, as kind of a side note, that as kind of food deliveries and deliveries of NFIs tend to go up in insecure emergencies, and the more complex health type of programming goes down, at the same time, we also don't see protection activities rise as you might expect it would, given the increased protection needs. It goes up a little, but not to the level you would think, given that these are protection crises, many of these situations that we're studying. So this is also a function of lack of access, making more complex programming difficult for agencies. Now finally, and this is kind of the take-home message of the study, is the fact that it's been so hard to get a clear picture of humanitarian presence and coverage in these places that what happens is coverage can appear to be larger, more robust than it actually is. So both agencies and donors have incentives to exaggerate the reach of their humanitarian efforts. And we make the point that humanitarian actors really undermine their own advocacy in this regard. By wanting to appear to their donors and to the general public that they are present and they are working where the needs are greatest and they're able to respond, inadvertently here they're making the humanitarian situation maybe seem less dire, and by extension taking the pressure off political actors to find solutions to the conflicts. I'm going to stop there as my time is up, but I look forward to taking questions and also to hearing Sandeep's presentation.
Great. Thank you so much, Abby. Really, really interesting. I'm sure we could talk about this for ages. Fascinating to see how you've taken a topic that lots of people talk about but don't really have a concrete or tangible feel for, and put some numbers on that, and it ends up revealing some very troubling trends, which I'm sure Sandeep is going to build on. Just before we get to Sandeep, a quick follow-up question for you on method. You just mentioned in your presentation that with the SAVE research, you tried to use statistical analysis or you did use statistical analysis to try and measure the impact of violent incidents on the level of humanitarian coverage at the subnational level, and ended up with no statistically significant findings on this. And so you turned to other components of the research to kind of build in that picture of the causal relationship between insecurity and the decline of presence. I was wondering, stepping back from this and looking at statistical analysis as a method, do you think as a researcher that these kinds of harder quantitative approaches to humanitarian questions are still valuable, even though they can't get us to kind of clear and direct answers on a lot of these questions? And also, how do you think we can become a bit more rigorous at understanding causal relationships without quantitative approaches, for example, using some of the qualitative approaches that you were using in this research?
Yeah. So absolutely. I think that most of us in the humanitarian sector would agree that in general the field is quite data starved, and the research has traditionally been, I would say, very qualitative and soft. So there are two types of statistical analysis, right? There are descriptive statistics, which can tell a compelling story, and then there's the inferential statistics like regressions, where you're trying to prove causality, at a level of significance. You can have one without the other in many of these cases. And as I mentioned, the first challenge is to go out and gather the data ourselves to build these data sets to analyze. Even doing this alone, bringing the data in is, I think, a worthwhile contribution. Having the concrete numbers is useful and important. Even if they're not conducive to regression analysis, they can still tell us some interesting things. But having said that, I do think it's important and worthwhile to continuing to experiment and to test the data for significance using various questions and variables, even if most of the time you're not getting the p-values that you hope for. And as an extension of that, as good practice and to kind of move the field forward and to avoid falling into the trap of publication bias, it's also important to publish the findings even when they're inconclusive, and to discuss the confounding factors, which we tried to do. You also asked about qualitative approaches and how to make them a bit more rigorous. I think you can do that. Interviewing is kind of our stock and trade in this field. That can be made, I think, more rigorous and systematic through more thoughtful and representative targeting of interviewees and more structured analysis of it. So you're not inadvertently putting more weight on the most recent interviewee, for example, and really being aware of cognitive biases when you go through the information that you've gathered. And finally, for a few years now, we've been calling for increased surveying of the affected populations, which is possible now through this technology, and really allows you to reach people in remote and hard to access locations. And I think that's important because it gets us away from the more tokenistic small focus groups and situation you see sometimes where an agency will only survey their own beneficiaries.
Great, thanks so much, Abby. Really interesting perspectives there on how to combine these two approaches and their distinct values, and on the surveying point as well, how much easier it's become to get some of this richer data. So we're now going to hear from the practitioner perspective on this issue, which is a really important one. And to help us understand what tools and approaches practitioners are using on the ground to answer these questions, we're going to turn to Sandeep Bashel. Sandeep has been working with OCHA as an information management officer since 2005 and has been in Afghanistan for 3 years. Sandeep also has experience working in disasters and complex emergencies in Nepal, Myanmar, Darfur, and Pakistan. Many of our listeners will be familiar with the 3W forms that OCHA uses at country level to map presence, and Abby has just referred to these as well. But the question is, what is OCHA doing to complement these forms to get a fuller picture of presence and coverage? We're going to be hearing from Sandeep on this, but just a quick minute. Sandeep, I think we're seeing only part of your PowerPoint slides, so I think we will run your PowerPoint slides from our end, and you can just start your presentation and tell us when to turn the slides over. And I should just also remark to everybody in the room that if you have questions of clarification, I neglected to mention this after Abby was done speaking, but if you have any questions of clarification or follow-up discussion questions that you'd like us to cover after Sandeep's presentation on either Abby's or Sandeep's presentation, please start entering those into the chat box under the questions tab. Great. So Sandeep, over to you to talk, and then we'll be turning the slides over on our end.
Thank you for this opportunity to talk on this webinar. I am just going to do a quick run through of the traditional 3W tool that we use in Afghanistan, like in any other countries. Just a brief methodology of how we use it and what we're using it for, its scope and limitations. And then I'll be also going briefly about some supplementary tools that lets us do more in-depth analysis on humanitarian presence. Okay, the OCHA 3W in Afghanistan is basically just a list of organizations by the sector and district. So nothing more, we don't collect any more data than that. This is mainly because these NGOs and other partners have a lot of reporting to do, and we don't want to put in additional burden on them. So we just asked them 2 questions. We just asked them whether they have an active humanitarian programming or have carried out an humanitarian assessment in the last 3 months. And by humanitarian programming, we mean projects that are in line with the Humanitarian Response Plan Monitoring Framework or projects under the Common Humanitarian Fund. So these go into the operation. These lists of organizations go into the operational presence, and then we have a separate list for agencies that are not strictly humanitarian. They are not currently conducting humanitarian activities, but they have access to the districts and the capacity if there's a need and funding is available to actually conduct humanitarian programming. The data is collected by OCHA sub-offices. There's no direct reporting from the agency to OCHA, so it's just actively collected. This just gives us a baseline overview of what agencies are present in the district. So this is just a simple methodology of how we collect the data. So our sub-offices collect these names of agents and just acronyms of agencies directly through phone calls or through coordination meetings. It's not collected in a very structured way, so it's just a comma separated list. And back here in Kabul, we take all that data apart, compare it to a standard list of organizations. We assign them the names of actual names of the organization and type of the organizations so that we have a structured data. And some of these agencies do not want to be named publicly. So we filter out that information before we create our products. So our products are just the regular products, thematic maps, data that you can find on the Humanitarian Response Humanitarian Data Exchange website, and interactive dashboards that you see at the bottom below. Along with the names of agencies, we also maintain a contact list of at least one contact per organization. So these are also collected by the sub-offices and we consolidate them here. And some of the key contacts are, we manually add them to the humanitarian ID, which is kind of a which is a global contact list of humanitarian workers. But for Afghanistan, it's not quite public. You have to be a verified responder to be able to access that list. Our interactive dashboards do offer some level of analysis. You can just look at the coverage by sector, by type of agencies, or even click on a district or province or a region to see who is reportedly working there. And you can also see trends over time. If you look at the green dashboard, it has data since 2013. So you can just scroll over the data and see how the coverage has, how the presence has changed over time. So the 3W is more of a baseline list of humanitarian presence, partner presence. We call it presence and not coverage. Because it had some limitations. This is the most comprehensive list of organizations that are working in the districts and includes local agencies or other partners of partners who may not be directly reporting to the cluster system. So the main use would be to actually click on a district, see who's working there, and find somebody to contact to get more information on the district. And of course, we can see changes over time on the number of personal partners. It just provides a baseline data and it has some limitations. So it does not really show the extent of coverage in a district. Like a district may show 15 organizations working there, but there could be just one person from the agency visiting once a month to the district headquarters. So it's not an indicator of either the scale of the response, capacity of the agencies to provide support, or even gaps in response even if we compare with the needs. Also this 3-month cycle does not give an accurate picture of presence in a constantly changing humanitarian situation. So there are these supplementary tools that we have to get a more accurate picture. There is a cluster reporting system against the humanitarian response plan. So all the clusters have their own activity-based 3Ws. Although the level of detail and the frequency of reporting, it varies from cluster to cluster, but all of them have the number of beneficiary supported by type of activities. We have a periodic monitoring report for the HRP, and we use this information to measure the progress against the needs, targets, and identify potential gaps in response. The other tool is OCHA collects. We have these two different tools, the natural disaster tracking system and the displacement tracking system. So our field offices collect top-line information based on assessments in the fields and reports from partners on internal displacements and areas natural disaster events. This includes number of affected population, number of people displaced, and also the organization provided in assessment and response. So it's activity-based, and the data is live, so it's updated every day. We can use this to actually identify changes in the humanitarian context, like which areas have been difficult to reach, and who's working in these areas. I just talk about how the 3W does not have any information on capacity of organizations. So the Common Humanitarian Fund, to be eligible to apply to the fund, NGOs have to go through a two-step process. First step, where they submit an initial checklist of their activities and capacities. So that qualifies them to be a potential partner. Those who qualify in the first steps, it's called the due diligence review. There is a more detailed assessment of the partners. It's done by an external consultant. Those that qualify also receive a risk rating. So this helps identify potential partners that would be working in hard to access areas or that have the capacity to respond to emergencies. In Afghanistan, due to these hard to access areas and high conflict incidences, CAS-based programming have been getting more popular. There was also a partner assessment conducted recently of these CAS-based transfer programming. So there is a mapping of the list of partners who have implemented these in the past, and they are, who are implementing these currently. So it's also a capacity mapping of these partners. It gives them a ranking of each partner has received a score of their ability to deliver these CAS-based assessments. So these are some of the tools. In 2017, one of our priorities is for the humanitarian response plan is improving humanitarian conditions in areas of conditions for people in hard to access areas. There is an access advisory group under the humanitarian country team who is looking at a more systematic approach to measure access indicators and as well as humanitarian coverage in these districts. So that's about it from my side.
Great. Thank you so much, Sandeep, for a really great whirlwind overview of all that OCHA Afghanistan is doing to get a grasp on the presence question. We've had a couple of questions come in over the chat room, Sandeep, so I thought I would put two of those to you if you don't mind. I know you've just been talking quite a bit, but the first question is a pretty straightforward one about the DTS and NDTS, if that's publicly accessible. So is the DTS and NDTS publicly accessible? And the second question, and that question was from Katerina Hamed. The second question is from Michael Tarsila, who is an evaluation consultant working for UNICEF in West Africa. And Michael has asked, in response to your first slide, I have a question on capacity measurement. What tools do you use to measure the operational capacity of humanitarian actors, such as international NGOs, that might be interested in contributing to the humanitarian response, but do not yet have any presence or staff in the country or in the affected areas? So that's a question. You mentioned, Sandeep, a few times about operational capacity, that the 3Ws don't assess this, that you have the CHF partner capacity assessments, and then the specific cash capacity assessments. Beyond those that you've already discussed, are there other capacity measurement tools that you can use to measure the operational capacity of new humanitarian actors, new international NGOs that are not currently part of the response but want to become part of that response. And then the first question on DTS and NDTS and it's being publicly accessible. So if you could answer those two questions, Sandeep, we'd be most grateful.
Yes, the DTS and NDTS are both publicly accessible. The data is in the Humanitarian Data Exchange platform, and there are interactive dashboards both in the Humanitarian Exchange platform and the Humanitarian Response website for Afghanistan. For your second question, like when I talked about operational capacity, it's not really a capacity assessment. So it does not really, although the name suggests capacity, but it's not really a capacity. It's just a potential. It's just a potential capacity of organizations that may be able to provide humanitarian assistance, but who are not currently doing so. Other than the CHF and the recent gas-based programming, we currently have any other capacity assessment programs. Even though, like for new NGOs, even though they are not working in Afghanistan, they could certainly always be a partner of other agencies that are working. There's no restriction that the agency has to be previously working in Afghanistan to apply for these capacity assessment for the CHF. Does that answer your question? Like they can have a track record in other countries?
I think that gets to the question, Sandeep, and I think if Mikhail has any follow-up, they can feel free to contact us and we can follow up after the webinar. But I think that that's a really good overview response to that question. We also had a question of clarification for Abby. Coming in from Claire Barnhorn, who's wondering about how you did the counting, Abby, in this research. So how were different MSF entities such as MSF Holland, MSF Germany, and MSF OCB counted towards the NGO count? You know, were they included in that NGO count or were they counted somehow separately? So Abby, just a quick clarification on that.
Yeah, just quickly, it depends on how they, on their own model and how they identified in the field, whether as separate organizations with different management structures and staffs. If so, we counted them accordingly. For the kind of cross-country global index, where we looked at the most and least present, we would combine the federated organizations into one, and that would default to the most present affiliate.
Great, thanks so much. And speaking of MSF, I'd like to pose a question to both of our speakers that was sent in to us by MSF Spain. So Abby mentioned that MSF produced their Where is Everyone report in 2014 around this issue of presence. And MSF over the past year has now been producing a new series of reports on presence and coverage called the Emergency Gap Project, and there will be a link to that coming through your chat box. The Emergency Gap Project identifies the enablers and disablers for effective emergency response in armed conflicts, really based on the perspectives of MSF's operations and field practice. Their most recent report reflects on the role of insecurity as a factor in reducing operational presence, so very relevant to this discussion today. And based on this work, MSF would like to pose the following question to Abby and Sandeep. The question is, how do you think humanitarian donors and actors need to be changing their perceptions and attitudes around risk in order to improve presence? So Sandeep, you mentioned issues around risk and data sharing, and Abby, I think that was a theme in your presentation as well. How do these perceptions of risk affect agencies' decisions about where they go and where they operate? Do data and evidence play a role in changing these mental models and bringing about a mind shift, or do you think it's more based around the practical commitment of the humanitarian principles? So for example, Abby, you had your red map, and Sandeep, you also had the map on your fantastic dashboard showing the gaps in presence and coverage. When humanitarian actors are faced with those maps, does that compel them to act differently, or do you think that this is going to be driven more around practical commitments to humanitarian principles? So we'll look to you, Abby, first to respond, and then followed by Sandeep.
Okay, it's a really good question. I personally think that the more data you can gather, the better. The more information you have, you should use. And because we know that risk is often misinterpreted or exaggerated in some cases in people's minds, that it's good to know exactly, what the past experience has been in certain areas. You see a kind of an access inertia in places like Afghanistan, where agencies are staying in areas perceived to be safer and reluctant to kind of test the waters in new areas. So I think the more information you can have, the better. But we've also argued that humanitarian actors and donors need to move from a mindset of risk transfer to risk sharing. And I'm not sure if that's completely appropriate to the question here, but what we see is donors tend to push the risk, real or perceived, onto NGOs, and the NGOs push it out to their local staff and local partners. And what needs to happen is a more clear and explicit acknowledgement about the risks that are involved, including both security risk and fiduciary risk, and a kind of a shared ownership of these risks by both donors and agencies, with the understanding that after all the mitigating and preventive measures have been taken, there will still be a residual risk that could be realized, and that both sides need to understand and accept. So I also think that in terms of data, studies like SAVE and information like OCHA is doing can press the issue. And I can talk more about that later, because I think I'm kind of heading off track.
No, that's perfectly on track. Thanks, Abby. And Sandeep, what are your thoughts on this question from MSF Spain?
I just give you an example of Afghanistan. Most of these agencies are present towards the northern side of Afghanistan, and there's limited presence in the southern side, where there is higher level of conflict. Some of the reasons could be is that like the north historically used to have a higher presence, more development activities. It's also more prone to natural disasters. So there were DRR activities. The conflict has, although it was previously it was mostly concentrated towards the south, but now it's moving towards the north. And organizations have just adopted this coping strategy to limiting their presence to urban centers, scaling back their presence. Although there is enough evidence that there is more humanitarian need in these harder to access areas or more conflict affected areas, partners are basically lacking this incentive to move to these areas. So maybe donors could provide them this incentive, although there are risks in terms of programming. You might not get as much as return in the investment in hard to access areas than in easily accessible areas. It's more of a question of practical commitment than the data that's available. That's what I think.
Great, thanks, Sandy. Really, really interesting, talking about the incentives that need to be put in place there, and this idea of return on investment raises some really interesting questions that are being faced right now as we look at these significant and growing gaps in coverage. So a lot to think about. I want to pick on a question that we got from a number of participants and registrants before the webinar about tools and methods that they can use to map who is doing what. So the START network has asked, because they are interested in developing a methodology to map the presence of its 42 members. And others have been asking about online platforms or other tools that they could be using to map presence. So I'm wondering, Abby and Sandeep, what are your practical recommendations for, it sounds like mainly INGOs or INGO networks, that they can use to map presence in different countries, particularly countries that are highly insecure. So again, Abby, over to you first.
Okay, so we were really arguing that it needs to become an operational norm for organizations to have and to readily share this information within their coordination structures. So whether that's a smaller network like START or kind of the country level clusters. We do tend to think that it's better to do this as broadly and universally as possible, not really to fragment it within different structures and platforms. So the broader the better. But you can see that with just a few key data points, you'd be able to put together a pretty decent picture of humanitarian presence. So that is, every organization should be able to report at the national level and provincial level and district level for instance, the number and location of their offices, number and location of their staff, or if not the actual staff numbers, then the number of paid positions, because staff come and go, and that's very changeable. Also, the number and location of their activities, meaning the projects or components of programs that they're implementing, either directly or through their partners, and the number of total beneficiaries that they're serving, again, down to the district level. Now, if all of this information was available from the individual agency levels, which I don't think would be so onerous, then compiling it and reconciling it for the whole country to deal with this sort of double counting issue, things like that, really wouldn't be a huge methodological problem. The difficulty really comes in when someone has to go around, as our researchers did, and sort of manually extract the information from one organization at a time.
Great. Thanks so much, Abby. And I have a follow-up question for you on that. But before we turn to that, Sandeep, any thoughts on tools and methods they can use? I mean, I know you've presented a number of tools that OCHA is using. Obviously, there's tools being used by the clusters and HCTs. So are you thinking that INGOs should really try to work with those tools and make them work for them? Or are there additional tools and approaches that you would recommend?
I think for a start, like there could be a basic data collection, something like if it's a consortium of NGOs, they could have a registration process with just some basic information. And all of these agencies do report to their donors, they report to their clusters. Maybe it might be a good idea to just get that data from those agencies rather than asking them to report all those activities again, like a duplication of reporting. Like NGOs are, they also have to report to the government. So there is an kind of an overload of reporting requirements. I think it might be a better idea if we just collect basic information, like what Abby mentioned, number of staff, district coverage, and get the detailed information on activities from other sources that they're already reporting to.
Great, great. Fantastic. Thank you both. Abby, just picking up on this piece around having people actually on the ground to help collect this data, you mentioned in your presentation that you use field-based monitors to collect information on presence and staff in very hard-to-reach areas. I was wondering, is this an approach you would use again as a researcher for humanitarian outcomes, and would you recommend this for people who are seeking to improve on-the-ground accuracy by partnering with local researchers?
Yeah, well, the answer is yes. When you're actually going out to create and build the new data sets, there's really no substitute for field level research if that's where the information is. And that really means having the time and the budget to make that possible. So we were lucky in our case that DFID saw the importance of this, and we got a generous kind of 6-month inception period followed by 2.5 years of a research phase. So that really enabled us to have teams working on the ground for several months at a stretch, which is what made it possible to do the heavy lifting of counting and verifying humanitarian presence data. Now, different countries will have different levels of capacity for local research. And it requires that you invest in scoping that out as part of the inception period of any study. There are, of course, good ones and bad ones, and you need to look at track records and references and beware of some local research outfits which have been accused of falsifying findings in the past. But in general, it's the best investment you can make.
Great, thanks so much, Abby. Sandeep, we also had a question around updating this data over time. So there's a question that came in around systematically collecting and updating evidence on presence in a constantly changing humanitarian context over time. So this is increasingly what we recognize as our humanitarian reality. How does OCHA try to stay updated on your understanding of presence as it shifts and changes over time?
So these two tools, the natural disaster tracking and the internal displacement tracking system, they are basically live. Like we get the data every day. We still have a very simple data collection process, but there is minimal time in processing. So the data is almost live. It tells us about where the new displacements are taking place, what are their needs, what response is being provided. That's the first step. And I mentioned earlier that the Humanitarian Access Working Group is working on a more systematic approach to collecting information related to access and coverage. We're not quite there yet, but this year it will be our focus.
Great. And Sandeep, if I could ask you to just elaborate a little bit on that in terms of how often do you think this data needs to be updated? I mean, how quickly do you feel it changes? You've been in Afghanistan for 3 years. How much does the presence of humanitarian actors and their activities in particular areas of Afghanistan stay the same or change over time? Does it need to be updated every month, every other month, or is it more of an annual process that you think would be suitable?
No, it changes all the time. So one day an area can be accessible. Next day there is a major security incident or an attack, and there's no access to the area. So it's a very volatile situation here. This data should be updated as often as possible. So we should have a mechanism to actually monitor the situation as it happens.
Great, and we'll be looking to OCHA to have that on a dashboard pretty soon. That sounds really handy. Good, so moving on to a few questions about best practices that we've been receiving. So we had a question around the best practices of identifying and working with hidden actors in emergencies. And this picks up on a theme that both of you have talked about, which is on anonymity. And this is a key feature of the operating environments of many of these insecure settings, and one of the issues that really prevents a clear and accurate picture of who's doing what and where. So we've had a few questions around anonymity. One question is, how can we get over anonymity to identify good local partners? Another person has asked about the connection between anonymity and corruption risk. So the fact that organizations are operating anonymously presents certain risks around corruption. How do we know organizations are behaving appropriately if these operations are being kept secret? And finally, a question around coordination. So how can we strengthen coordination within hostile environments, particularly subnational coordination, which ALNAP's research on coordination has highlighted as being a major area where we need to have improvements and we need different approaches. How do we strengthen coordination at the subnational level when humanitarian actors are operating anonymously? So those are three different issues, but all connected to the overarching challenge of anonymity. And to answer this, Sandeep, we're going to go back to you first, followed by Abby.
For Afghanistan, although there's some of these actors do not want to be publicly mentioned in public reports or papers, they are involved in the coordination structure. So they are not quite hidden actors. So even in the field level, they regularly attend the coordination meetings, and they raise a coordination system at the national level. So I don't think the actual we have these really hidden actors in Afghanistan.
Okay, okay, great. Thank you. And over to you, Abby. What are your thoughts on the challenge of anonymity and addressing these three issues?
Yeah, I was going to make the exact same point, that when you get down to the local level, the aid actors know who each other are. So anonymity really only extends so far, and there is coordination that's happening. If the question is more about how to identify the good local actors to work with, or to find new ones, we did talk about kind of looking beyond the traditional humanitarian actors when it was necessary, to see what other sorts of actors and mechanisms might be able to get access, for instance, local commercial actors, if that's necessary. But where they are present, the local organizations, it's, I think, less about finding the good ones among them than it is about creating good partnerships. So my colleague Catherine Haber's research component on this, on maintaining access and quality, found that better access can be achieved when the international actors take the time to assess the partnership, so the institutional and operational capacities of the partnership rather than just the partner, and strengthen the areas that are important to the success of the partnership. So this will also, it will involve each partner complementing the capacities and compensating for the weaknesses of the other partner. And it really does go both ways. And this is maybe slightly off topic, but I just really wanted to get a word in about the National Red Cross and Red Crescent societies, which usually have very good access relative to other humanitarian actors, but don't tend to be utilized as operational partners very much by the international agencies, apart from their cooperation with the ICRC and IFRC. Now, I know that sometimes they're seen as partial or potentially too close to the government, but in areas where needs are high and access for humanitarians is severely constrained, I think the international aid community needs to ask themselves if the outcome of no aid is better than aid that could go in that might be problematic in some way. So I just wanted to make that point.
Great, thanks, Abby. I think that's a really important point, in terms of the mechanism versus the end, and how humanitarian actors choose to work and how they choose to deliver, and whether or not it's in a sense flipping the principled question on its head, right? Because it's the sense in which being principled can actually shut us off to opportunities to enhance humanitarian presence, as opposed to pushing us to expand those areas of presence. So I think it's a really interesting and important point. We have a question, actually, Abby, that's come in over the chat, and I'd like to encourage everyone else who's with us to continue asking questions, any points of clarification that they might have on either presentations. Abby, the question for you is, can you elaborate more on complex and simple programming? Is there a rule of thumb used in determining which one to apply given a particular situation or context?
No, I don't think there's any rule of thumb, and I don't think there's really any blueprint for organizations doing this. I think it happens kind of organically, where in a less insecure place, organizations will be doing programming at a different level. The longer that you're there, for instance, the more technically complex you can get, and the more freedom you have to move staff around from other parts of the country or international staff that would have the technical skill sets one needs for doing that kind of programming. So it's just something that happens. It tends not to be optimal, and we did see results in the affected population surveys that said that a large portion of the aid they received did not meet the most urgent needs. And in Syria in particular, people saying that really they'd had enough of the hygiene packets and food packets, and wouldn't it be great if there was more cash so that we could actually buy precisely what we needed instead of just receiving these kind of packets over and over.
Great, thanks so much, Abby. And kind of picking up on this issue, it's a point of clarification. We've been throwing these terms around quite a bit, presence and coverage, but Sandeep, there's been a clarification question for you based on your presentation. You mentioned that in OCHA you use the term presence rather than coverage because the latter is limiting. There's no question of what did you mean by that? So where do you see the gaps coming in between presence and coverage? And how does your mapping of activities and monitoring of activities help you understand coverage instead of presence? So if you could kind of elaborate on your earlier comment in your presentation on what you mean about the difference between presence and coverage, and that you find coverage to be a bit limiting.
Presence is just whether a partner has some kind of programming in the district. It does not say anything about the scale of the program. They may just be visiting the district once a month and just doing an assessment, so that's still presence, but coverage would mean the extent of, it could be geographical coverage over the district rather than the organization being present just in the district administrative center. Coverage could also mean the number of beneficiaries that they are assessing. So that's how I wanted to differentiate presence and coverage.
Great, thanks so much. We have another question that came in before the webinar from CARE, one question from an M&E advisor at CARE and a participant from NATO, each asking a similar question but about a different actor. So CARE has asked, what role can governments play in crisis-affected countries in the accurate mapping of humanitarian actors and in monitoring quality? And a participant from NATO asked, how can the military contribute to defining who is doing what in a crisis or conflict area? So we've kind of been talking about OCHA-led processes, INGO-led processes, and perhaps humanitarian research-led processes to map presence. But what kinds of roles can governments and militaries play in helping us understand the presence of humanitarian assistance and humanitarian actors? So Abby, if you could comment on that first, what you saw in your research across these 4 different countries, and then we'll move to Sandeep.
Yeah, well, to be honest, in the 4 conflict-affected countries that we were dealing with, we actually thought less about the role of host governments, some of which didn't really have the capacity to keep up-to-date registries of NGOs, and some of which you wouldn't necessarily want to know the operational details of what agencies are doing. We focused more on the role of donor governments in terms of us being surprised that they hadn't been more insistent on getting what seems like pretty basic data from the HCTs and their grantees in the field on presence and coverage. We know that donors can encourage and promote coordination and underpin it with their funding decisions. It kind of all depends on how high a priority they place on it. But in terms of host governments, yeah, it was not a big part of what we were looking at.
Okay, great. Thanks so much. And Sandeep, your thoughts on this from the Afghanistan perspective?
Like we are always looking for more accurate geographical data or satellite imagery that militaries and governments would have access to. So that would, in Afghanistan, like we don't have any sub-district boundaries, so accurately mapping humanitarian presence, like we can say this organization is in a district, we can go down to whether it's in just the district headquarters or in the surrounding areas, but we can't really point out where they are working in the district. So accurate geographic data is like that would really help us. And in Afghanistan, the government is not that involved in mapping who's doing what, or more on humanitarian presence. But sometimes, like in Pakistan, you need a permit from the government to carry out humanitarian activities. So that can actually be a hindrance than actually helping the mapping humanitarian presence. So
Could I just ask you to clarify that last point, Sandeep, in terms of, people being asked to register to carry out humanitarian activities by the government? Would that not, in some sense, help kind of at least the mapping of humanitarian presence? Maybe it inhibits the presence itself, I suppose, but does it not help centralize the information on who is doing what and where?
but the governments also sometimes do not want to share this information, so that's another hindrance. And this registration process often takes a lot of time. Like even to visit some areas, you need a permit from the government. That can be more of a hindrance than it's a benefit.
Great, thank you. Um, Abby, we have another question that's come in here that we think will give you an opportunity to geek out, which is totally what we want to do on this webinar, since we're talking about evidence and the use of evidence in research. So there's a question of if you could briefly explain, because you've talked about the method that you used and the unique features of the different components that you pulled together. Could you briefly explain how you decided on this mixed method approach? I think in many cases in humanitarian research, one has a question where one could do really interesting creative things with the method, but there's always this matter of deciding what pieces to bring together and what to do and what to leave out. So if you could maybe talk about the background or the process on how you put together this mixed method approach and decided on the different components, and what kinds of criteria perhaps did you prioritize in your methodological decisions?
Sure. I think because we've been dealing with humanitarian operational security data for so long and dealing with the problem of getting rates, right? So you need the aid worker population in order to get rates, so you can really see whether violence is getting worse or better in different areas, et cetera. And it was always a major stumbling block that we didn't have good population data. So when this project came together, we kind of wanted to start from there and look at what presence and coverage actually look like in the field, just because it wasn't there. It's something that is there to be known, and we should know it. So I think the data was kind of central and primary to what we were doing. And data is just going and counting things. So that's what we decided to do. Now, the other things that we were trying, the regressions, et cetera, kind of came later. When once you have the data sets, you can decide what it is that's interesting to look at, what stories the data can possibly tell. But we would never do that without contextualizing it with the actual qualitative information that's coming from the people who are on the ground and experienced, and that's where kind of widespread interviewing comes in. And the effective population surveying is still fairly new, and something that we've been experimenting with in a couple of different projects, including State of the System. And not to plug it again, it's something that really we think should be brought more into research on humanitarian assistance, because the voice of the actual end user, the consumer, has not been well heard, and you find some really interesting things. And just to maybe make a point of one thing that surprised me when we looked at the effective population survey data is that when people were asked what their most urgent needs were in these protracted conflict settings, they tended to be protection in the case of South Sudan, or food in the case of most of the others, as the number one need. But the number two, or at least in the top three needs of every single one of them after that, was education for children. And I had been one of these people that had usually dismissed the education and emergencies cluster and things as, well, that's not life-saving, et cetera. But it's the salience with which people hold education for kids, even in very dire crises and conflicts, was I think striking, and it's something that it's worthwhile bringing these things out. So I don't know if that really answers the question, but I think our tools are limited in research. But like we were talking about before, we all need to get more empirical and more evidence-driven in what we do.
Great, and just a quick follow-up on that, because you mentioned, one of the pieces that you did this for earlier on was one of the previous iterations of the State of the System report, and now more people are using these techniques. Do you worry about survey fatigue with affected populations as a result of that?
Well, the sample sizes for an overall population are not huge. I wouldn't worry about it given the polling and surveys that we get in my country, the United States, and around the world. It's still very limited what's going on in the field. And it's interesting that respondents are often given an incentive for participating. So you probably have less of a worry of survey fatigue if someone's getting sort of 50 cents for answering a survey. I think it's a good means.
Great, thanks so much for that. So I think we've reached our last question here, and it's a question about impact. And actually, I'll ask Sandeep this question first, and then we'll end with you, Abby. So someone has asked us, how does an accurate overview of presence affect impact? And I kind of take this to be this big so what question. We've been talking a lot about presence and understanding who is doing what where. How is getting better data and better analysis of presence going to help us achieve better impact with humanitarian assistance? How do you connect the dots in that theory of change for yourselves? So Sandeep, if you could take that question first, and then we'll give the final remarks to you, Abby.
A more accurate overview of presence and the needs would highlight gaps in presence or gaps in coverage, but for the impact, it's still up to the agencies that are working. They have to have the incentive to go to areas of greater needs. It's more of an operational issue than the data issue, I think, because although this the information of presence and gaps might not be centralized and accessible to everyone at the field level, everybody knows where the needs are, so it's really more of an operational issue than a data issue. That's what I think.
Interesting. Controversial, but interesting, Sandeep. Always like that. Good. So very thought-provoking. And Abby, your thoughts on the presence and impact question?
Yeah, well, it's such a good question because you're right. And so what? So this is really more than just an issue of knowing what the aid worker population is, area by area. And I agree with Sandeep that what it does is give a clearer picture, or a picture that people really hadn't been seeing, of the gaps and just how small the humanitarian presence really is relative to the needs in many of these emergencies. And this can help, I think, become the humanitarian efforts become less supply driven when you're really seeing the sort of drop in the ocean that some of the response is relative to the need. But also, it's essential to good preparedness to have a known inventory of capacities and sort of troop strength, if you will. So before the next escalation of the conflict or new natural disaster that occurs in these places, to have this information at the ready will improve the response and I think have better outcomes and impact.
Great. Ending with preparedness, always a good topic, another topic that we don't look at enough in this sector. So it just leaves it to me to thank our two fantastic speakers today. We are putting up some additional links for people to follow up on, and we will be sending the audio or links to the audio and the slides in a couple of weeks' time. So thank you very much to everyone who sent in questions ahead of time and who participated today. And thank you again to Abby and to Sandeep for a really good discussion on presence and how we can understand it better. Thank you and have a wonderful afternoon.